So I'm trying to see what it looks like
Can't hear
today.
you.
We're 30 seconds from going live. Well, probably 10 now.
Yep.
So I just wanted to let you know.
It did go back up a little bit.
All right.
164 new cases today, so we're still in danger territory.
Are we
getting
going?
better,
Are we
though.
on now? Okay. We're
Don't see
ready.
John
6
Irvin.
o'clock? Nope, not quite 6.
5 seconds.
5 seconds, he says. All right, 6 o'clock. Here we are. All right, welcome everyone. Thank you for joining us and rejoining us after closed session. I want to let you know that we did not take any action during closed session. And welcome to, for the recorders, the July 20th, 2020 special board meeting held by the Modesto City Schools Board of Education. And we will take roll call again so that it's on the record. We have Trustee Brown. I see Trustee Brown. Trustee Irvin. Do we have him back? I don't see Trustee Irvin. No Trustee Irvin just yet. We have Trustee Lopez. There he is. There's Trustee Irvin. All right, he's here. Trustee Lopez. We have Trustee Lopez. I see Trustee Newman. Trustee Walker. Yes.
Here.
President West. Yes.
Here.
President Marks. Thank you. And now for translation services for anyone that might need a translator. Our services are provided by Ms. Paula Valbuena, who is on this virtual conference call. And Ms. Valbuena, will you please go ahead and translate?
Thank you, President Marks. Buenas tardes. Habla Paula Valbuena. Si necesita servicio de interpretación al español, por favor marque al 1805-324-7680 e ingrese el código de acceso 442-410-737, seguido de la tecla numeral. Este es un número totalmente gratis. Una vez más, puede llamar al 1805-324-7680 ingresando el código 442-410-737, seguido de la tecla numeral. Igualmente puede acceder por medio de nuestra página web mcs4kids.com, dirigiéndose al final de la página debajo de Quick Links y haciendo clic en Board Agendas para escuchar la junta de hoy. Thank you.
All right, thank you very much, Ms. Valbuena. And now I will read a comment into our record because the reason why we're doing this virtual. Good evening, everyone. This is an open session meeting of the Board of Trustees. Is being live streamed at the direction of the board. The live stream is available on the district's website and the recordings will be available for viewing the day after the board meeting. Modesto City School Board meetings are closed to the public to follow state guidelines on social distancing until further notice. This action was taken in response to the Governor's Executive Order N2520 and Resolution 19/20-17, delegating authority to take necessary action to protect students and staff from the spread of coronavirus, also known as COVID-19, adopted by Modesto City Schools on March 18, 2020. Regarding public comment, Modesto City Schools has provided an opportunity for the public to provide comment. It is outlined on the agenda. The public has been given an opportunity to call in and leave a voicemail or send us a comment via an email address. This practice will continue throughout the time we are conducting virtual meetings. For members of the public that are interested in commenting in the future, we welcome your comments. So now I will lead us in the Pledge of Allegiance. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. Thank you all. And now we will move on to our one item on our agenda for tonight is the discussion on opening of the schools. And so I will turn it over to Dr. Noguchi. And Dr. Noguchi, were there any questions or comments related to this item?
There wasn't any questions or comments related to this item. So first off, I'd like to say thank you for being prepared to come to a special board meeting. I recognize we have a board meeting next Monday, and believe it or not, a week away is a really long time in the environment in which we find ourselves in. So thank you very much. I really just want to focus tonight on opening schools in two manners. One, I facilitated and participated in a total of 3 forums from last week and got many comments and feedback, and we'd like to share those with you. I do know that I shared that also in hard copy form for you. In addition, the governor has provided some guidelines. I think it's more than guidelines, but directives around the closing of schools and opening of schools, and we'd like to share that as well. But ultimately, this is a little different than just a regular report. I really would like to hear from you. What are you hearing from the community? What are you hearing from individual neighborhoods, family members? I just want to be able to get your voice into the work, given that we've got 3 weeks left before school starts. So I wanted to give an opportunity to just talk deeply about opening schools. So with that, I'm going to turn it over to Brad. Brad has a presentation that'll last about 10 minutes or so, and then the rest of the time is really just feedback from you all. It'll help me as we move forward with a course of action. So with that, Brad, I turn it over to you.
Okay, thank you, Dr. Noguchi, Board President Marks, trustees, and cabinet. It's my pleasure to be here this evening to highlight the preparations and the information that you need to understand where we've been and where we're at and where we're going regarding the opening of schools. So tonight's presentation will focus on an update regarding the orders from the governor's office that took place last Friday. We'll outline our options for opening schools. We'll also, as Dr. Noguchi mentioned, highlight some of the input and conversations that we had with the community and staff last week in the online forums, as well as, of course, at the end, get your input, feedback, and answer your questions at the conclusion of the presentation. So our current conditions, as you know, our county is a hotspot of coronavirus positive cases, over 3,900 positive cases in the past 2 weeks. Our hospitals have reported that they're understaffed, and a number of social events over the last month or so, including the 4th of July, are contributing greatly to those very high positive cases. In addition, our county health is also backlogged with the contact tracing. And, you know, just for perspective, we know our hospitals are doing the best they can at staffing, those understaffing issues. We know that the county health office is working diligently to do the contact tracing and the staffing and the things that they need to do. But those are definitely the conditions that we are challenged with as a county right now. Our county superintendents, if you don't know, have been meeting regularly on Mondays for the past several months. On the 13th, Dr. V met with superintendents and made some determinations that schools should open in August with the distance learning model that at that time with the issues that we had in the county, we suspended all of our summer sports conditioning that we had started about 3 or 4 weeks prior to that, as well as all co and extracurricular activities. So generally speaking, everything that we had rolled out on a very limited basis in controlled situations, we suspended due to the COVID positive increase in our county. So at that time, or now, we know that for our schools to open, that it is a state and local decision, and obviously our governor's office at this time is the trump card in that. And the state announced last Friday that there were updated guidance that they outlined what it would take to reopen in person, as well as the guidance for what in-person instruction will look like when we open, as well as guidance on how we will potentially close schools if we bring students back onto the physical brick and mortar campuses. Additionally, schools may reopen once the local health jurisdiction, i.e. our county public health, identifies that we have not been on the state's county monitoring list for 14 consecutive days. Currently, Stanislaus County is on the monitoring list, and that is a key issue. So looking at how we will be opening schools, as you're aware, as we presented, I don't know, it might have been a month ago or a few weeks ago, we are looking at two instructional models for the opening of schools. First, our distance learning model, which is providing instruction with our current teachers to students in a more synchronous environment where they're engaging on a day-to-day basis, as well as an expansion of the Modesto Virtual Academy, which is an independent study program utilizing the Florida Virtual curriculum. So what have we done between the spring and now to really prepare for the opening of schools? An incredible amount of work has gone in, hundreds, I would venture to say thousands of hours of preparation across our divisions to prepare ourselves for this. We've developed our distance learning platform, TK12. We have instituted a number of professional development opportunities, including 37 modules, 126 videos, and up through a few weeks ago, I think upwards of 46,000 views of those courses. Our instructional coaches have provided support up through until the end of the school year with daily office hours. And of course, we're expanding the Modesto Virtual Academy from a 9-12 program to a TK12 program. Additionally, there were a number of professional development opportunities offered for our teachers over the summer. You can see the number of courses in each of those areas. I pulled that directly off of our Schoology account for our certificated staff. So you can see that we've got 7, 14, 21, 25, over low 30s of courses available for staff to go in. Those are opportunities for professional development that they can do through the virtual platforms, go in and receive that training without even having to come into contact with others in the PD department. So our distance learning model, just kind of set the expectations for what distance learning will look like as we open the school year. And these expectations are grounded in Senate Bill 98 as well as the 3 ed codes referenced there. That really is the foundation for what we have to do relative to distance learning. First and foremost, the implementation of the distance learning model in the state of California has to include access for all students around the idea of connectivity and devices. So obviously not just a device in students' hands, but how are we getting that device connected to the internet so that they can access the daily instruction. We have to have content aligned to grade level standards, which were with our team of teachers, we have that in place in distance learning, as well as we have to support the academic progress and identify how we're going to support students that may have learning gaps through the distance learning model. Additionally, SPED and other related services must also be identified in our distance learning model. Additionally, we have to provide English language development, both the integrated and designated formats of ELD in our classrooms. Those are mandates that are not exempted at all. So we have plans in place to do that on a daily basis. We have to have daily live interaction with certificated employees. That is significantly different than what we saw in the spring with the model that we had when we were in school closure. So this will be a great upgrade, so to speak, of what the distance learning model will look like beginning August 10th. Students have to participate daily. We also have to document that participation. Teachers have to ensure that they keep a weekly engagement record, which students are not just logging in, but how are we documenting that students' engagement during that time, not just the login time. We also have to create a written procedure for our tiered re-engagement. We're working on that as well, meaning for students that are absent for 3 or more days in a week or miss 60% of the instructional days, we have or will have a plan of how we are going to re-engage that student in the distance learning model. Basically, how do we get them back into the digital classroom? Our distance learning model has to include a blend of direct instruction, small group instruction, intervention, as well as independent work. So when we're talking about a school day in the distance learning model, And we're still working on what that structure of that school day looks, or the schedule that you would think of as far as a bell schedule for our teachers and our students. But what we do know is the time that is spent in that schedule has to or can include any number of those blends of instruction. It does not necessarily indicate that our teachers have to be in a live stream, live feed for every instructional minute, but we can have a blend of those activities. So you can see here from this slide that the required minutes of daily instruction, again, those are the minimum number of instructional minutes that need to be provided in the distance learning model. Again, during those minutes, it can be a blend of instructional activities, but really here the key point is our students and teachers will be interacting synchronously, live at times, direct instruction, etc. And we're working with our Teachers Association now to identify what that structure will specifically look like. Now, our virtual Modesto Virtual Academy, happy to say that we signed a letter of agreement with MTA on July 14th. Highlights here that this workforce of our MVA program is staffed by our existing teachers. We've established what those caseload maximums are for our teachers. Every teacher meets with each student on their caseload a minimum of 1 hour per week. And that 1 hour is really centered around academically checking in with the student to see how they're progressing, making sure that they're staying on track, progressing through the coursework, as well as checking in with them on their social emotional well-being. We know that in school closure that our students are going to struggle, and that it's more than just academics. It's the social emotional health of our students that we need to be in tune with and provide supports as well. Our teachers will be responsible for obviously providing supports for students, checking in on their social emotional wellness, monitoring the progress, providing instructional support, having established office hours for parents to engage and know when they can contact the teacher, as well as assigning the students' grades. We will also have MVA available for special education students, as well as through the distance learning option. We have established those caseload maximums, as well as understanding that there is a requirement that it does take an IEP meeting to change the student's placement to independent study, and that our special education department has provided guidance for our staff in that area. So as you're aware, last week, Dr. Noguchi led 3 community forums to garner, one, to answer questions from our community, but also to get their feedback. And so we held 2 of those meetings on Thursday, the 16th, one in the middle of the day, as well as one in the late afternoon. We had more than 1,000 participants total in those 2 sessions, as well as on Friday, we conducted a community forum for our staff and our teachers, which occurred Friday morning. And we had more than 720 people participate in that online forum. These 4 bullet points here really centered the questions that Dr. Noguchi posed to our community and our staff, which is really, what in the spring worked well? We want to replicate what worked well. We also asked them, how can distance learning be improved? What supports do we need to have in place, not just for our students, but as well as for our parents and our staff? How in the online distance learning environment, what additional supports do you or your student need to be successful, as well as additional feedback or input? So we did provide a link for that, and we've got a very robust cross-section of input and feedback from our community as well as from our staff. We picked up on some themes from that feedback. Our teacher and staff input really centered around ensuring student accessibility, not just to devices, but more so to internet access. Questions around assessment and grading, around student accountability. Teachers and staff are concerned about the hours of work. What does that look like in the distance learning environment? Questions and comments around safety, working from home versus working in the classroom. Questions centering around MVA staffing and how that would impact school sites, and how MVA staff would be selected, as well as some staff providing input of their desire for students to return. We know that that is the best model. Additionally, some themes from our community. They had a lot of questions around the schedule, both for distance learning and MVA, meaning what is the structure? What does that school day look like? Are there specific days and times for classes? And so we talked about that. Concerns around the safety for when schools do open and students come back. Questions around students with disabilities and how we will support them in both instructional models. Nutrition services, questions about meal service to our community, as well as, again, accessibility for distance learning and internet access. So our next steps, we started today with our first day of admin week, where Cabinet and Dr. Noguchi met with all of our district managers, certificated and classified, through the virtual Microsoft Teams platform. We are starting the plan, or not starting the planning, we are implementing the planning for ongoing support for parents, teachers, and students on the website and other resources. We're developing the frequently asked questions that will be posted regarding MVA as well as distance learning, and we're in the process of developing parent support materials, some of which will be in the form of videos for our parents so that they can learn more about how they can support their students along the way. So that was a very quick overview of where we've been from the spring to where we are now, and happy to take your comments and questions.
Okay, so I see Charlene has her hand up and we're getting the screen back. So let's go ahead with Charlene and then Chad and then Adolfo and then John. I'll see if I can get that down.
Thank you for this report and all of the information. I think we all have a lot of questions, you know, even the board members and community members and all of our staff, of course, have questions. I was interested in the summer professional development that we offered. You gave a list of everything that we offered, all of the courses to help our staff prepare to teach online. What was the participation? What were the numbers like for participation in those courses?
So, Ms. Odell, can you answer that?
I can. There's a little bit of a difference. Let me explain. Those were created and self-paced. So people got to take the different courses and retake it, pause it, go back. We wanted to give people the opportunity to differentiate what their questions were. We followed those with the live office hours for our instructional coaches. So if someone went through it and needed more or needed clarification, or maybe it took them down a different road of professional development, they could then ask the questions. So we had a mix, really it was like a blended learning type of mix. Online courses, then you could get with an in-person support. So it wasn't that we would have 20 people in a room at the same time. It wasn't that kind of format. Does that clarify a little bit for you, Charlene?
It does, but I know during the school year we had percentage of our staff members that participated in those optional PD.
Oh, yeah.
And so I just wondered how many of our teachers logged on and participated in these trainings.
Okay, thank you for that clarification. So in the meantime, we also had our 0.5 professional development compensation initiative. And for our teachers that finished that, we had, I think we landed at 69% of all teachers finished the 6 hours of PD for that compensation initiative. After they finished that, then we were able to save some funding and pay them on top of that. So we had some people using these professional hours as part of the 0.5 compensation initiative. And then we had other people, they'd already finished that, and then they got summer pay. So I can get back to you on a set amount of hours that we had in those terms, but it was varied because they were participating in different forms.
Okay. It seems it seems like a great opportunity for staff to get a little bit of extra training because we're going online and a lot of teachers need help. They need support. And so I was just curious to know, did our staff participate? Did they take advantage of this? Was it beneficial to them to be able to get this extra training and preparation for going online? That was just the reason for that question. So, and then I had just one other quick question on devices for our entering kindergarten students. Will we be providing devices for them going online?
Yeah, I know. Hi, everyone. It's Mark Herbst. I don't mind answering that question. Absolutely. Device distribution is going to occur before the August 10th date. So there was a meeting today. They rolled out some information to our principals and starting to put the work together on the schedule that's going to occur at all of our elementary sites. But yes, to answer your question, yes, they will.
Okay, thank you. That's all for me.
Okay,
we are also providing computers to our paraprofessionals this coming year as well, which is going to be able to help with the distance learning.
Oh, good. Okay, Trustee Brown.
I've got several questions, but let me ask a couple that relate to special ed. First of all, there was reference just a second ago about our paraprofessionals. I'm curious about our paraprofessionals and our one-on-one aides. So many of our special ed students are only able to have success if there's someone beside them. And in many cases, the parent is not capable of providing the trained expertise that a one-on-one or a paraprofessional is prepared to help with. So how can I'm hearing this from numerous parents who have special ed students. They feel like they're being left out, and especially working parents who have special ed students. And the time that they're able to provide is not necessarily during the time that teachers are going to be providing this online distance learning. So how are we going to be able to accommodate the needs of these specific parents?
Well, do you want me to take a stab at that one right now, and then we'll go to the next one?
Please.
Yeah, there is no doubt, and I would say this emphatically, and I think everybody in here would agree. If you ask me where I would like our kids educated, it would be back brick and mortar, no ifs, ands, or buts about it. You really are, though, Trustee Brown, you're kind of talking about that population you're calling with is not special education is a big umbrella. And we've got students with mild, moderate disabilities and moderate, severe disabilities. But I think probably some of the families you're talking with are those that have some probably either significant delays and or early children with autism, perhaps, et cetera. So the special education office has worked tremendously to get our staff to be in coordination and conversations with families about the things that they can do at home. But you are right. In some situations, we cannot replicate the great work that we do within a classroom setting in a home setting, in which case that we can't, or it's been deemed unsafe to go into the house. So all special education providers, designated instructional service providers, related service providers reach out to those families and offer their support, assistance through teletherapy at times, interactions, strategies on how to work with their child until we can get them back. Again, it's a small population, but it is a population that's near and dear, I think, to all of our hearts. But we will continue to look for ways that we can try to bring that group of students back quickly, I would say.
Thank you.
Let me follow up with some specifics related to that and a couple of questions. Our teachers are going to be involved in this distance learning. What happens with our non-teaching employees? How are they going to remain employed?
Are you talking, if you're talking about paraprofessional staff, I can speak to those.
Specifically paraprofessionals and our one-on-one aides.
Okay, what Dr. Noguchi had said is going to be a big benefit as compared to what we had done in the spring. We will arm all of our paraprofessionals with devices and set up situations to where our paraprofessionals will be interacting with that student from a digital format. That will be new, and we will get that off the ground this year. I think with the ability to have an adult behind them, that will assist us in better meeting the needs of our students. So yes, they will be working with the kids with whom they're assigned.
Okay, so I have, as I mentioned, I have parents who have children with special needs who are working. They're in essential jobs. There will be numerous people in essential career positions who will need to work and cannot be directing the activities of their children in their homes, at least not during the hours that we have programming available for distance learning from a classroom. They are looking for people who can come into their homes and provide the services that they're not able to. I'm wondering if we have a group of people who are not working, who are available for people to hire to come and help.
I don't know of individuals that aren't working, Trustee Brown. I just know I know that most of the people you're referring to are probably clients of the regional center. That's Valley Mountain Regional Center, I should say. What supports and services they could provide in home would be something that would interest me. The only thing that I would probably turn around though and say is that I would imagine some of their fears in terms of going into the home right now might negate some of the respite and or support that they were providing families before. A lot of entities have moved into a distance digital format, which again, it's your questions are great questions. They're difficult for me to hear because I can understand the situation. Unfortunately, I don't have the answer on how to get additional individuals into those homes to help out those kids, which is truly unfortunate, but I don't have that answer.
Okay. I had to ask the question, sorry.
Oh, hey, completely fair question. And again, just difficult for me because like I said, I can relate and I understand it, but no, good question.
Okay, moving on to Trustee Lopez.
Yeah, hi. My question was in regarding the meals. I know that we'll be giving meals starting the school year. So how are we going to work that around? Is there going to be any changes to the meal schedule that we have currently, given that now we have students that are going to be in distant learning and the times in which they're going to get meals, or where the closest meal location will be to them is at staggered times? Do we foresee any challenges to that? And how are we trying to mitigate that?
That's a great question, and that's Mr. Zerley question, but alignment of lunch distribution with the schedule that we are currently crafting, that's not something I thought about, but Mr. Zerley gets to tackle that one.
Yeah, this is Tim Zerley. Right now, our plan is to have the current distribution model that's been working so well for us. But Chris Atwell and his team is working on options that for the distance learning model around times, and we hope to have that by the end of the week. But currently, the plan is to use our current distribution schedule at various locations throughout the district that has worked very efficiently and effectively so far.
Yeah, I think we've been doing a great job with that. I just figured that might have to look different with in terms of scheduling kids and teachers, and when certain kids, how much time we have to give so that we allow folks to go out and get their meals, which is important.
That's a great question.
Yeah, we will. We'll follow up with board communication as to the plan based on the current instructional schedule for distance learning.
Thanks.
Okay, Trustee Irvin.
Yes, two of my questions Trustee Brown asked and got answered, but I had also, Trustee Lopez, I had a similar question. Whereas for the nutrition, I was thinking about, since kids may become latchkey during this time period and things like that, do we have our crossing guards that will be stationed to help safety in terms of safety to get students to the lunch areas for their meals and things like that? What are we doing to ensure the access safety during the school year, given that some parents may not be able to escort students to or other people to escort them to their lunch location? Will we have crossing guards, or has that been discussed about that as well?
I will answer that too. At least as far as school safety officers go, we do have school safety officers working their schedule, and they will be providing safety resources, much like they do now at the various locations where we're handing out meals. And we also have campus supervisors for us who will be, we will have work for them to do, and they will be reporting for work. And so we should have enough bodies to provide adequate and necessary security and safety for our families as they come and go, whether it's for lunch time activities or other activities.
Okay, thank you.
Is that all your questions? Okay, Trustee Newman.
All right, thank you. Thank you to the district staff and Mr. Godot for that thorough report, and to everyone working on this. This has been a Herculean task, and there's just all these issues that just still keep coming up. So I appreciate your continued tireless efforts. So on the issue, parents keep asking me, working parents, is if they can still work, or does someone need to be there to make sure that the child does their work? And so they can find somebody who can do childcare, but not necessarily somebody who can make them do the schoolwork. So that's a common dilemma with many parents. So that somebody can watch over the child, but may not necessarily be able to help with the schoolwork. So what is our anticipation for what are we looking at in terms of our anticipated participation of parents?
Well, this is Brad. I'll take a gander at that. First and foremost, we still have the tools in place that parents had access to in brick and mortar to monitor student progress. The parent portal in Schoology provides, in PowerSchool provides parents the opportunity to go in and check on student academic progress in the form of grades, assessments, homework, etc. So that is still in place. We are working with MTA to identify the specific instructional schedules that will be utilized day to day. So once we have that locked down tight, then our parents will know when a specific content area or instruction will take place during the day. So those things are still being worked out. And as you heard from the presentation, in the MBA model, we'll have opportunities for office hours and connecting with parents through that regard in that model, as well as in distance learning, where teachers will have opportunities during the day for parents to connect in with them. So obviously, depending on the child, right? I mean, that's a family decision. At what level or at what age, at what grade can the student engage in the distance learning or MVA model without the parental supervision, and when do they need someone by them to ensure that they're staying engaged through the day? But again, one of the big requirements of SB 98 is that we are monitoring and documenting the progress and the engagement of students on a daily basis. So that's going to take a collaborative effort. I mean, there's no doubt it is going to need to be a very tight partnership between our teachers, our district, and our parents. And identifying the supports that we can provide parents is one of the key pieces of work that we're engaging in now.
And thank you. That helps. I think so. My concern is also So we have access to these, Power School and such, and there's security on that. When I sign into my kid's Power School, I've got to have codes. And there's maybe going to be a need for some parents to have childcare providers that provide that access. Do we have easy forms that we could distribute to parents to allow that kind of access to occur? Because we would need their consent.
That's a great question. If I'm understanding you correctly, I think what you're asking is, would a child care provider have username, password access to a student's?
If the parents want them to, could we easily provide the forms for them so that the parents could pass that off to a child care provider and make this a little easier?
I don't know that I have an answer to that, but that's definitely something that we can investigate and get back to you on.
So let me add something into that. So here's my thought. One, if the parent gives the access to the codes, the kids are going to have the computer, they can have access, and they can get on. There is currently videos to be able to teach parents how to access Schoology, how to access the different platforms, that whole piece. So we've got many videos that show that in different languages as well. And I know this year there's going to be a much more targeted thrust at our parent professional development, and that really goes to the daycare. How do you help and support your child through this process? So we will have videos for that. The other piece is Mr. Sulkin and his team is continuing to work on a data dashboard, which is going to allow us to know how many kids have checked on teachers, students, staff, all of that around how they're accessing the different platforms and when. And so that'll be coming out in the next couple weeks as we work to develop that. So two things. One's the accountability piece with the dashboard. The second piece with the training. If I was a parent and I was looking for childcare, part of the childcare would be, are you interested in getting this training? And then I'll pay you to get this training, and you take the training, and we will have the videos for that.
Trustee Newman, I'd like to just add a little bit more to that as I've had a moment to pause and think a little bit more clearly on this. Is a parent could provide the child care provider the child's username and password to ensure that the student is connected, because really on the day-to-day ongoing support, it's the critical piece is that the student is connected into the distance learning or the MVA. So having the child care provider being able to ensure that the child can log in. And for the most part, I believe the vast majority of our video trainings available to our community are available online and don't require any additional username or password access. I think that, and Dr. Odell, you may be able to clarify that a little further, but I do believe that, as Dr. Noguchi suggested, a child care provider could go in and get themselves trained to what to look for and how to support a child within their program.
You're absolutely right, Brad. In fact, we created a YouTube channel, so we felt like this information was so important. We don't mind who sees it. If it helps other school districts nearby, great. Our focus is making sure our parents and our guardians are prepared. We have created a brand new student website and parent website. It's literally ready and just waiting to go to be uploaded. Every time we've had a meeting about it, my question has been, as it's been created and I'm looking at it, is can the parent use it? Can anybody who's not been in the classroom before ever, is it friendly to them? Can they understand? Are we using too much academic jargon? Is it for just anybody to be able to support, including then, all right, now let's take it to the next language. What languages are we providing this in? So it's accessible to anybody, and I believe it's user friendly to everybody too, for the most basic users.
Okay, thank you. And Trustee Walker.
You said that we don't have any public questions, correct?
We do not have any public comments, no.
Because normally we go questions, public, then back to sort of board discussion. I don't particularly have questions. I've sort of compiled a whole sort of litany of things I've learned. And so it's more of a prepared statement than anything else. And I've sort of put it into three categories. The first is disappointed because of all of the hard work over the last 5 months needs to be acknowledged. People have missed days off. They've skipped vacations, long hours, dedicated to ensuring that Modesto City Schools will be ready on August 10th. When this started, we immediately acquired devices so every student had access.
Awesome.
Russ and his team ensured Wi-Fi hotspots. We delivered devices using meal pickups as an access point. We've got agreements with our labor partners without any acrimony I'm aware of, which is just amazing work on everybody's part. We've implemented a brand new independent study program providing choice to parents, which I think is critical, and certainly 2 thumbs up. If I could add more, I would. MCS continued to dial in and use spring and summer distance learning to improve and work out wrinkles, issues so that we will be ready for a fall opening. And it will be vastly different than what we did in the spring and summer because we learned. And I think all of that just has to be held up as just exemplary work by everybody. Fantastic leadership from the superintendent. And I think what people don't realize is emphasizing partnerships. You know, whether it's this issue or 2 years ago with fires, Dr. Noguchi's approach is to build consensus and work with partners so that everybody's on the same page as we all move forward together. And it's a critical part of leadership and it needs to be acknowledged. And as Amy has mentioned, neither of us are going to be here soon. But if there's anything I walk away with is that not only did we make the right choice, we made a brilliant choice. And your ability to adjust and pivot within our framework to create a plan that results in success for students, families, and staff needs to be acknowledged. To my colleagues on the governance team, you know, we began this 2 years ago with the reorganization, and every department was retooled and rejiggered and moved around. But that was based on a book that I got with the superintendent that was based on building capacity. And it's critical to what we've done. The ability for Mr. Godot or Miss Odell or Russ or anybody else to go out and pivot and move forward and do the job and do it well is based on building capacity. And that's got to be acknowledged. All of us supported that. And I think it's critical and key to our success. I think the next word I put everything into after talking to people with was sad. There's always going to be those that are going to complain about direction and decision. My threshold is always, does it determine student success? Are we student focused? Our high school seniors, including my daughter, are devastated that their senior year has been put on hold. Senior sunrise, proms, anything social is now very questionable. And it's a huge deal to these students. If people don't realize that, then my response is find your heart, because it's a really big deal to these students. Our English learners need extra support. Direction instruction is going to be tricky in this particular model. How do we ensure they have a chance to get reclassified? That's a huge hurdle, and especially as they get older and distance learning is going to make that much more difficult. Trustee Brown mentioned special education. It's always been something I've been really concerned about. It's even more critical when we look at distance learning, as Trustee Brown pointed out. Technology with some of our younger students, and Mr. Herbst mentioned our autistic children, it may end up being just a placeholder. And I think that's sad because they need support just like everybody else. And it's a much higher level of support. Our student athletes have lost their seasons. And again, those that are seniors, if you got a senior that played football or baseball or something, you've lost your last chance to play on a sports team unless you're going to play in college. That's sad, it's tragic, and it hurts. I think the other piece that I got from a lot of folks is a lot of anger. And I certainly have a lot of anger and frustration and irritation that doesn't go to the National City Schools. I think it goes to the higher level of government, those above our pay grade who needed a plan that doesn't seem to be there. I was advocating 3 weeks ago that we had 7th and 8th grade to opening our schools. And I came off of that position and changed my mind, not based on a statement from a governor or a health service agency. It was based on looking at the data, talking with the superintendent, looking at what community members have said. I didn't need guidance from them. I think looking at news reports, and this is where I get really frustrated. We've had 5 months, and Modesto City Schools has done an amazing job. But I look at other county organizations and I have real questions, and so do a lot of other people. Hospital grade medical PPE. How is it a surprise that we were going to be shortages out there? We've known this for 5 months. Local media is now reporting frontline medical workers are rinsing masks. Nurses are wearing rain ponchos in hospitals. That's tragic. It shows a complete lack of planning. I don't know what happened to the $96 million in CARES money the county had, but you had 5 months to stock up. Annual flu season is 120 days away. How are you going to mix this COVID problem with annual flu season with similar symptoms? There should be pallets on top of pallets on top of pallets of actual equipment to help support our frontline medical workers that were provided by the county. Hospital surge building capacity. I still don't see an answer as to whether or not we're fully staffed. Is it that we need more people than we had in January? Do we not have people back from January? There's no clear answers there, and it shouldn't be a hard question to answer. How do we build capacity? How do they handle a surge? This won't be the only one. And I think all of these factors go into why I decided that there's no way we can open these schools up, not because we're not ready, but because the entire community is not ready. I look at testing. How did the county board not know we were going to have problems with testing supplies? It's very similar to the PPE for our frontline medical workers. Why were you not stocking up? You had $96 million in 5 months. I don't see anything out there that says you built a supply. Access is a can of worms. Case reporting 2 weeks ago when I was looking at this was a nightmare. You couldn't tell what was true, what was not on the county dashboard. One number didn't match up against one number on the page. Public confidence in the leadership at the county level is critical. How do you expect anybody to listen to the guidance you're giving if they don't trust what you've said? And I think it's critical. I got so frustrated, I turned it off and said, it's not worth my time. I can't tell one fact from another fact. Self-quarantine, I mentioned, I talked with Mark Herbst on Saturday a bit about this. How do our parents who are in communities in small houses, you've got 5, 6, 7 people living in a small house, you're told to self-quarantine. How does that work? I mean, you can't go into a 2 or 3 bedroom house and get in the back and have 5 people living there and not potentially infect them. I don't know what the solution is, but if you don't have the conversation, you can't address the problem. Back to education. One of the requirements appears to be that all of our teachers are going to need to be tested and then retested. Mr. Henderson gave me a number, said about 3,000 if we round. How are we going to test 3,000 teachers in Modesto City School Districts and then retest them potentially? It doesn't count the other 24 school districts in this county. How does the county go out and explain to somebody that couldn't get a test because we're out of supplies, because we were testing teaching and health education professionals? It's a no-win situation. My conclusion, essentially listening to everybody and talking to folks and putting my own thoughts down, it's a story of 2 different governance teams. You have 24 different boards of education out there doing everything they can to get these kids back, which is where they need to be. And then you've got a county leadership out there. I can't repeat how proud I am of the job you've done, Superintendent, Mr. Godot, senior levels, staff, planning, Miss Odell. I couldn't have asked for more, nor could any of us, and you delivered all these things. But yet, at the county level, we're missing PPE. We don't have stock on testing. There isn't, what I can tell, any reasonable plan to manage a surge. I can't, in good conscience, put our students, teachers, and families at risk if the county can't take care of the county. And I think that's extraordinarily disappointing. I think it goes to a failed leadership model, and I still don't know how you explain what happened to $96 million in 5 months to build a long-term plan to keep us safe, and there's no answers out there. I have questions, but they don't go to this district, they go to a higher level. It's extraordinarily disappointing, frustrating, and irritating. And I'm done.
True. Thank you, John. I do know that I could tell you're very passionate about this, and It is true. We have dealt with a lot of changes. I was telling somebody it's like trying to hit a moving target. Like we can't ever get to the bullseye because it keeps changing, and it's changing sometimes on a daily basis. And yep. Sarah's had she's made a plan. She's worked really hard. She's a great leader, and now we're back to square one again. But thank you for your comments. I know that it resonates. Many of them resonate with a lot of us. So I saw a few heads shaking. I did have a couple more questions, and then I'll have a comment. And then after I make my questions, I still have Trustee Brown on here. Did you mean to stay on there, Trustee Brown? Okay. And then I had Trustee Lopez. I saw your hand go up, so I still have you on there. So back to the questions that I had were, so I was thinking about as a parent, though the child care is a huge issue for our working parents, but let's say I'm a parent at home. What does the day look like? How many minutes does my child spend on the computer today? So I get up in the morning, I get my kid ready, whatever, feed him breakfast, if I have breakfast, or I feed him what we've been handing out to our students the day before. And then I sit down. It's 8 o'clock, 8:30. Normal time I'd start school or I'd get my kid at school. So now, what does my day look like? Do I work until 10 o'clock? Are they on this computer till 10? Take a break? How does the day look for our students? I'm just thinking if I'm a parent and I'm looking at it. Now, we saw a chart earlier, a couple months ago or a month ago, time flies, that had a great plan for our students. Are we still working from that plan? Are our parents aware of when they're going to get on with their student? Do they know how much time they're going to spend on each day? Of those, I have let's say a K's kindergarten's child. I'm supposed to have 180 minutes of instruction today. How much time is my child going to be on a computer doing something? So that's kind of, or a third grader.
Mr. Henderson, would you like to run with that, or I'm happy to answer that?
I can tell you, and you can add to this, Brad. The SB 98 tells us how many total instructional minutes are required, and I think you referenced, you may have seen those numbers. The difficult part about answering that is we are very deep right now and meeting with MTA and negotiating the letter of agreement around distance learning. We've proposed, a schedule, but I think it may be a little premature given that we were meeting with them for several hours today and scheduled tomorrow to discuss things that, really are being discussed and not yet agreed upon with specifics. So I wouldn't want to disrupt those ongoing conversations. But I can say in general, we have been talking about a schedule that has structure to it relative to the different content that kids need to be taught, ELA, math, and different segmented time, so that I think we may be shifting it here or there, and I think it would speak to a parent relative to what a kid should be doing at a given time of day. And that was a lot of the thought of the subcommittee that came together and really kind of thought way out of the box on if we were to go this direction in these different models, what would that look like? And they considered both, what instructional minute requirements we have, what parents' needs are, and the student, and how we can best balance all those pieces. So not a complete, ability right now to post that out and take a look at it. We hope to close up those discussions and reach some agreement very soon.
Good, because I know this is something that parents are really desiring out there, just trying to plan their fall. What are they going to do if they do have childcare? What are they expecting their childcare to do? And how many minutes a day are they going to be helping their child? So I'm going to throw this out there. I did talk to the superintendent a little bit about it because this week, and thank you for, almost all my other questions were answered. But I had a meeting with other board members around Central Valley, and some of them are looking at doing really as a board, looking at having their classrooms open for students for 8 students to be able to social distance, but in the K through 3 grades, because those are the most critical age groups right now. And then data also shows that they are the least vulnerable to the COVID virus. So between those two, it seems extremely important that we have a discussion at least about what that would look like. Could we do that? Would the county tell us no? And so, and I see Dr. Noguchi has her hand up. She has a comment on that. I'm looking at people trying to get back to work, trying to do their work. It's just a really, well, it's messy, as we've talked about. It's a really difficult time. And granted, we prepared with PPEs and we prepared for all of these situations, and now we're like, can't do it. All right, so I will stop and allow the superintendent to speak.
Yes, and you made some really good points, and everybody has that on their mind. So I just want to say a few things. First off, and this goes to John's point as well, today's positivity rate was 27%. That's completely outlandish, and there's a point why I'm sharing that, and I'll get to it in a minute. That's completely, it's the highest in the state. I believe Imperial County is higher, but it's so far out of bounds. What the governor wants to see is 8%. So that gives you a context to where we're at. So 2 things. One, when we come back in a phased operation, how I would like to see and how I would like to first frame it, and certainly we'll get feedback input from our labor partners at U and parents, but I would like to see our kids that are most vulnerable, TK and kinder, foster youth, homeless, and our special ed. So how can we accommodate that group first? So I don't know what that looks like, but I do know that those are going to be the kids that we phase in first to see if the protocols we have in place are working, but we can't do it now because there's too much infection rate. We just had to close, and this is going to be new information for you because I just got the text a minute ago, that we now have to close Martone's ECE program. Last Friday, we had to close down Everett, and the day before we had to close down Tuolumne. So the three programs that we had open, and there were 10 kids to the class, everyone wear PPE, everyone having their own individual stuff, trying not to mix, putting everything in place. It's not going to work with an infection rate of 27, but maybe it'll work with an infection rate of 10, right? So I hear everybody. We'll get to that. I agree with the TK Kinder piece in addition to our vulnerable, but we need to figure out what is that rate. Do we have to go all the way down to 8? We were at 8 when we were back in March and April when we weren't having anything. We were having like 5 a week. So we need to talk with Dr. V on what is that infection rate that's going to allow us some opportunity to reopen ECE and reopen with the groups that you're talking about. And I share that because I don't think I've shared all of that with Cabinet yet. So that's why I wanted to take that piece on.
Thank you. Yeah, it is. It's really difficult right now, but I can see that if we do a promotional program where we do get people wearing masks, social distancing, not having events together where they end up contracting it, it would be really great to see our numbers go down again where they were. So
well, and remember, we did have a child care center open from March to the end of June. No one, either kids or adults or those parents, but we were at a much different infection rate. So we know how to do it within a certain confines. We just got to figure out what that is. So I'll stop now.
Okay, no, that's good. Thank you for that information. All right, so we're going to those who had their hands up already. Trustee Brown, and I got you Trustee Newman too on there. So Trustee Brown, and then Trustee Lopez, and then Trustee Newman.
So just an observation that touches on things that several people have said. It appears to me that our most vulnerable students and responsible parents are going to be forced into an unemployment situation, which will further increase the challenge that we have within our county. So it's just a vicious cycle of not being able to provide services that are needed so desperately. So then the next question that I have has to do with the instruction that is provided by our teachers online, is there a way that that can be recorded so that a parent can go back and work with their child if they need extra help? Is there a way that that can be provided in also for the benefit of children whose parents have to work and the child may be left without instructional care during the day? Can that parent then turn on a recorded piece of instruction and then work with the child? And then if that happens, how can we as a district monitor that that's happening?
If you wouldn't mind, I can touch on at least a piece of that, and the technical, is it possible question, maybe Dr. Odell or another could. The one thing I think we have to be cautious of with the SB 98 language is when it says daily live interaction with certificated employees. This is students' daily live interaction. We have to document that daily participation for the kids. So we're having that conversation now about screencasting and the ability to do lessons in different ways. But one thing we just have to be cognizant of is there may come a time, there will come a time when there's going to be auditing of that daily direct live interaction with kids, and we got to make sure that we're able to show that and demonstrate it. Now on the technical side of what's possible, it looks like Mr. Salkin, I have to defer to him on that.
Yeah, technically it is possible. Just like this meeting here, we could record it. There'll be the same features for the teachers to be able to do that and send it home to the parent.
Yep.
Okay. All right, thank you. Okay, on to Trustee Lopez.
Thank you. First off, I wanna thank everyone for the work that they've been doing. My fellow board members, Dr. Noguchi, and everyone staff for not only their work but their patience and the quick turnaround on different issues that like we're talking about, that moving target. I want to talk to you. I want to talk to everyone about a little bit about taking a step outside of the school. What kind of mark can we have outside of the school? I know it's been a conversation I've had with Sarah, and talking with folks out there in the community. There's a lot of mixed messages, as many of us have spoken out there. A lot of misinformation. So I wanted to pose a possibility that if we can use some funding to do a campaign around information, right? We look at everyone's wants to come back to school, and the way that we see it is, like we said, we need to get down to that 8%, right? To even start the conversation of whether if we can come back to school. So I would like us to see to do more around informing our community around helping us get back to school, whether that's wearing masks, informing folks around proper hygiene, about washing our hands, having a campaign for the community at large of helping us get back to school by social distancing, by wearing masks, by proper hygiene. I just after talking with so many folks and seeing like we just need folks to stay inside, or we just need folks to wear a mask. And as I think that it's our duty as well. I know that we've done above and beyond, but I think we can do even a little bit more to show our leadership and saying, hey, we want to not only take care of our schools and making sure that everyone's safe in our schools, but in order for us to do that, we need to invest into messaging our information, or educating around the importance of the overall safety and well-being and health of our community. So I like to see if we can do something around that, being a part of that messaging, saying, hey, we want you guys to be healthy too, because it's important for our community, but it's also is important for the reopening of our schools.
Yes, so true. Yeah, I had a conversation with Dr. Noguchi today about that as well. And I think it really is important as we get that message out. I know when we've had the flu outbreak in our schools, that's been a huge thing that we, tried to get information out to our parents, and washing hands and all that hygiene. Of course, back then we didn't wear masks, but it's totally right on. And the social distancing, those are all great messages, and that's what we need to do. So I agree. I don't know if we can use any of CARES money for that, but maybe to target certain neighborhoods might be appropriate. So we'll have to have discussion about that and see.
I'll take a look at it.
Go ahead. Okay, good.
I'll look into it.
Okay, thank you. Trustee Newman, and then I have Trustee Irvin after Trustee Newman.
Well, I just want to thank the board for this discussion, and I thank you, Trustee Walker, for sharing your passionate response about the shortcomings. There have been shortcomings even higher up than our Board of Supervisors, I think, that have gotten us in this predicament. But I'd like to address something that I kind of have a unique perspective. I'm not sure about everybody else on the board, but I've been working, and my husband's been working every day since everything is shut down. And my husband leaves the house every day, and I have too most days as well. I've had some flexibility to work from home, but during that time, we've gone through various stages. So this is so we do as our staff is, we're contemplating the transition of them being at the sites, and that is being, suggested certainly as the best course for our students. And I truly believe that. I want to just share that it's actually been the best course for us. It's, I realized, I'm going to the grocery store. I'm very careful, minding my 3 C's, which is avoiding close communication, avoiding closed air things, and then also, not to definitely wearing my mask. So the 3 C's are great, and I think I'm blanking on the 3rd C. But the thing that's been interesting is through this process of going to work and being with other people who are scared. And of course, there's been some positive tests during this time. And so there have been workers that have been sent home. And so there's fear about exposure. It's always just about trying to make sure that we realize the greater good of what we're doing. And, for me, I work in law enforcement, and so there's a greater good, and my colleagues share that purpose. And for our teachers, the greater purpose is our students' education. And I believe that it's really motivating to focus on that greater purpose at this time, because it's so overwhelming. And there's going to be some bumps, and there's going to be moments where like, oh my gosh, you've got it, and I was in the room, and there's these panic moments, and they're coming, and there's fear, and I get it. I've been through it. And I haven't had the virus. Nobody in my house has had it yet. Thankfully. But I get the fear. I get it. And but it's times like this where we have to realize the greater purpose. And this greater purpose is our students' need, and trying to fulfill that need in a way that is as safe as we can. And so so I just, as we move towards this, and just trying to be motivated about, serving our students. I want to applaud our food service people who every day gave, I think the last number I heard was 600,000 meals out during the time between we shut down in March 18th through the end of school. It was 600,000 meals. And those meals were so needed to our community, and to those people who worked in our food service, who worked in our IT, making sure we were one of the few districts in the area that provided devices all summer to our students. My son has a device at home that he can use. He's still doing work. I mean, all of our high school students are still doing work over summer, or they should be. So there's just many things that we've done that uniquely position us to continue to work for the greater good for our students. And so I just want to say I hope that that's where we're able to reach, and it is it's almost a leap of faith in terms of going back to work, and there's fear. But we know what to do to try and avoid it. And all we can do is our best. And our kids need that. And to those parents out there who have talked to me and their students are sad, I'm so sorry. We do have emotional support that we're offering to our students. And so to access things on our webpage, I encourage parents to log on to our webpage and access those services. To those students who are just sitting back saying, what do I do now? To those seniors, this is a great time to work on your personal essay and get that statement done so that you are ready to go for your college applications. There's no better time to do that, and there's a ton of free resources online. The essay guy is a pretty good one that we used with my oldest son. So take advantage of this time. There's certainly going to be more flexibility in some ways with your schedule. So maybe that's a benefit. So maybe there's a bright spot in this. So these are my 3 cents. And so we're just going to forge ahead. And I appreciate the work of all of our district people working so hard on this. Thank you.
Thank you. You're muted, Cindy.
I think it was covering your face. That was your 3rd C. But I just wanted to say thank you to the staff. It's like they've had the rug pulled out from under them. Worked so hard to get to this point, and then we can't open. So frustrating. Anyway, okay. So I have Trustee Irvin. I have you on the list for comment or question.
Yes, I just want to. I got a couple. A comment and a question. One, again, to thank the kudos to our superintendent and our leadership team that we have in place, both executive and mid-level, that have tackled this pandemic. You know, I can liken it to being in the military in terms of being ready. You know, you be ready so you don't have to get ready. And so I think that our team of our superintendent, executive leaders, and the middle managers have responded to that call very worthwhile, and that we're in a place that you know, all of us know people from other districts and things like that, and some of the horror stories I hear up and down the state in terms of the response to this pandemic as it relates to our teachers, our students, our parents, and our support staff and classified staff. I think we're ahead of the curve, but we're also almost like victimized because of the information. And, you know, going back to what Trustee Walker was saying, you know, I can't call it, you know, the same way, looking at those statistics and looking at just the processes and the communication and things like that. It's almost like, I mean, I'm just going to say it, chaos, you know, at this point. And so going back to what Trustee Lopez was talking about, I think we should have some type of marketing campaign. We should not rely on the quote unquote supposed to be experts in this area to help us navigate the communication and resources to our teachers, our families, our students. I think we can up with one and put out some communications out there that enhances and goes above and beyond of what we're getting right now. It's just to say, we're as educators, you know, people come to us because we're the experts. Right now, we don't have that feeling in our public health that we can rely on the information, the guidance, and the resources to really make those numbers go down. But if we enhance the marketing, the resources to, you know, to wash the hands, you know, because we're closing down those Head Starts because of what's coming in, not what's going out, you know, from our programs. I think they're in sanitized environments, and it's what they bring to the programs. And so if we can minimize that by providing the marketing, the resources and things to get parents and students to do their due diligence and minimizing their exposure and their risk, I think would go a long way. I just think we probably need to up the ante and not rely solely on our public health department, which a lot of people feel has really let us down in our community. As we see, we take the lead or almost the lead in cases at 28%. I mean, that's just mind-boggling, given from where we started to where we are. So I just wanted to, kind of re-emphasize what Trustee Lopez and others were saying in terms of it's time that we have the knowledge, we have the expertise, we have the people that are leaders that could make this happen within the district, even though they're not the experts, so quote unquote experts in the field, but we can get the information that's already out there disseminated within our contingency, within our community. And so we play a dual role in that respect. So that's all I have.
Cindy, you need your microphone on.
We had a discussion, we had a discussion about how often are we cleaning our classrooms, and that if we were to open, we'd be cleaning them before the children came in, we'd be cleaning them throughout the day and then cleaning them after they leave. So they're cleaned often, and I know our priority is safety for our students, but yes, we can get this message out about what it means to just to help our community be in a safe place and not be contracting this disease. And so I totally agree. So thank you for the thoughts and comments on that. So I have two more comments. I have Trustee, I wrote it down, Brown and then Walker.
So I want to say thank you in advance. We're going through a tougher phase than I think we've anticipated, and tougher than we've been through yet. And I want to thank everyone who's going to be involved in helping our students find success. Thank you to the top level administration under Dr. Noguchi. Thank you to all our administrators guiding our different sites. And thank you to the teachers who are going to be working through very difficult challenges with our kids as we focus on the needs of our children as the highest emphasis of all that we do. Thank you to everyone that's allowing them to do their best. Thank you to the parents, and thank you to the students themselves for living with us through these difficult times and making it work. They're the ones who are going to be the true heroes as they learn in different ways than anyone has ever imagined. So thank you, thank you, thank you. It takes a team, and I'm glad to be part of this team because I have confidence in what we can accomplish together.
Yes, thank you. Well said. Good team. I just appreciate this board. Thinking about where I've been in the past, this is an awesome team to work with, and the superintendent and the team at the district. It's been a rough year, but it's been good. So I thank you for that. Thank you for commenting and thanking them too, Trustee Brown. Trustee Walker.
All right, just to reinforce, I think this what you just said. You sort of stole part of it. Was it? This really is such a good team because we get such a diverse, different opinion, and everybody has ideas, and they're generally good. I think Trustee Lopez nailed it. I think if you look at what I was talking about when I was being in my irritated, agitated state, is the chaos. And if you're going to get the community to listen to you, it needs to come from a position of leadership. It needs to come from something that's been stable and hasn't been essentially a whiplash motion, which has been everything else above us. If you wait for the week to change, the message will change. We've been solid, we've been consistent, and that if we use that sort of non-chaos platform, then go out and reach out to the community and say, this really is how you get back. And it's in everybody's interest, and it's coming from a place that hasn't given you whiplash or misinformed you along the way, it may be very well received and not get caught up in the other politics of whatever the heck they're doing on the other side of the street, wherever that street is, because it's been confusing depending on which day you pay attention. You know, what day do you read the newspaper? We went through that whole bit with they were at the limit, they weren't at the limit, they were at the limit. You couldn't tell from day to day what the actual story was. And if we come from a position of strength and consistency, get that message out there and the community will listen. We've got access to parents and children. And I've got to believe everybody wants their children back in the classroom. And if they don't, they've got the choice with MVA. But I think that's a way to sort of leverage our positive and our leadership and our lack of chaos, which is a good thing. Great idea, Trustee Lopez. 2 thumbs up.
All right, well, that concludes this report and discussion. I appreciate all of you. Thank you for making time tonight to have this special meeting, to come when we asked. We just appreciate that because I know it's been a difficult time. Thank you to Dr. Noguchi for the community forums and the staff forums so that we could get that input before this meeting and at least have some knowledge before we step to the next phase of what we're going to do. So thank you to staff for all the information you're going to collect for us and work on so we can see what some options are in the future and maybe where that CARES money can be used. So I will entertain a motion to close this meeting. Do I have a motion? Trustee Newman makes a motion. Do I have a second? Trustee Irvin, second, and the meeting is adjourned. Thank you very much. All those in favor, aye. 7:20.